Which guidelines do you recommend clinicians follow for the management of rheumatoid arthritis?
Thank you for the question. That's true that there are several guidelines existing, especially SCR, EULAR, and national recommendations. But the recommendations I would recommend are the EULAR recommendations because they cover a lot of aspects of rheumatoid arthritis, including the diagnosis, but also the treatment, and also all comorbidities that's related to the disease. And regarding the treatment, they cover a lot of aspects, including corticosteroids, which is a very critical issue of the disease, and also all the spectrum of conventional synthetic DMARDs, biologic therapies, and also targeted synthetic DMARDs. So they are very complete and comprehensive, and that's the reason why I recommend these recommendations.
Which guidelines are most commonly used?
In my opinion, ACR and EULAR recommendations are the recommendations mainly used. And in France, of course, we are also using national recommendations from the French Society of Rheumatology. And I think it's interesting because they are based on the EULAR recommendation. And there you have some adaptation according to the specificity of the country. But yes, to remain general, I think ACR and EULAR recommendations are the main recommendation existing.
What are the goals of treatment for rheumatoid arthritis?
That's a very important question. And I think one word is really important is remission, because that's, I think, the ultimate goal of the treatment of rheumatoid arthritis. And with remission, you have a lot of definition, but for me, it means that the patient has no symptom, no clinical sign of inflammation, and you control also the complications of the disease, including extra-articular manifestation and comorbidities. So we use the treat to target strategy with tight control to obtain this objective of remission. And with this remission, you control all aspects of rheumatoid arthritis.
What does a treat to target strategy really mean in clinical practice?
That's a treatment strategy. And I think it's different steps. The first step is to define with the patient. So a shared management with patient and the clinician to define an objective. And I think the objective may be different according to disease duration. But if you have a patient with recent rheumatoid arthritis, your goal, your target is to obtain remission. And then the treat to target strategy is how you will arrive, where you reach this remission. So it's important to see the patient regularly and to adapt the treatment regularly until you obtain this remission. So increasing the treatment, changing the treatment, being more aggressive until you reach your objective. And usually the objective is remission or at least low disease activity.